Hi, I'm Dr. Gonzalez, and I've been a dentist for about 30 years. Today, I'd like to discuss one of the biggest problems that I see in all my patients that come to the office. Most patients have periodontal disease, more commonly known as gum disease. It's prevalent in over 80% of the population. And sadly enough, it's one of those that we call quiet diseases. In other words, usually it starts early. Most people do not know they have it. It starts off by bleeding gums, some irritation around the gums, and sadly enough, if not treated in time, patients can lose the support around their teeth, namely the bone. A lot of patients that I see come in when unfortunately it's already in an advanced stage. That means that they have a significant bleeding around the gums, they have significant bone loss, and usually they come in complaining that they feel that there are some teeth that are moving. That's a clear indication that that bone that we were talking previously about has been lost. One of the first things we do when we see a patient and we do their exam, we do what's called a periodontal evaluation. Some patients are familiar with it, and sadly enough, a lot aren't, which leads me to feel that sometimes checkups are done and the gums maybe are not evaluated well. There's a special instrument that we use. It's called a probe, and it's like a dental ruler is how I explain it to patients. It has markings on it that are the measurements, 3, 6, 9, and 12. Those are depths that we measure. And as I mentioned before, once anything is over a 3, it's letting us know that those are areas of infection. This is part of what we call a comprehensive exam. You have your x-rays done, the doctor looks in your mouth, and this should be part of that evaluation. One of the big facts that I try to explain to the patients is there really is no cure for gum disease, periodontal disease. And what I mean by that is we help patients get healthier, we help them control the disease. And the only way we can really work together to have that control continue is by having patients come in on a periodic basis, usually every 3 months or 4 months after their treatment is completed, so that we can help them control it. One of the most important things patients need to understand is this bacteria lives in all our mouths. And unfortunately, some of us are more prone to have higher numbers of that bacteria. So once we get you healthy, all we want to do is help control the level of bacteria so that you do not have that bad progression and you can help keep your teeth. People can keep their teeth for all their life, but we need to intervene and do certain things along the way. I show this picture a lot of times to my patients because a lot of times they just aren't aware. This is a picture of a patient that has moderate to advanced periodontal disease, and I wanted just to show you the areas here of bleeding and a lot of what we call recession, how the gums pull away from the infection. This correlates then to those probing depths that we were talking about before, where there's bone loss under here. And we use that instrument called a periodontal probe to measure. It's very important because this way we can really customize the things that need to be done. We put the patients through a treatment, and we hope to get all this tissue healthy and then put them on what's called a maintenance schedule.